Welcome everyone, thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when you cannot maintain a 2-meter distance from others. I will now share our current case counts. There are 171,323 confirmed cases of COVID-19 in Canada and 55,362 cases in Ontario. Chatham-Kent has 371 cases and Sarnia-Lambton has reported 347 cases. Michigan now has 129,826 cases with 14,587 cases being in Detroit. Today, we are reporting a total of 2,688 cases of COVID-19 since March, an increase of 8 cases from yesterday. 3 are close contacts of confirmed cases, 1 is community acquired, and 4 are still being investigated by our nurses. 2,574 cases are now resolved, and 38 cases are active and being followed by our health unit. 1 person is in the hospital. Our community has lost 76 people to COVID. 53 deaths have occurred among residents in long-term care and retirement homes. There are currently no outbreaks to report at this time. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, shortness of breath, nausea, vomiting, and diarrhea. Testing is available by appointment at select pharmacies in Windsor with specific criteria for people without symptoms. Please contact Shoppers Drug Mart Pharmacy for further information. Testing is also available by appointment at the assessment centers in Windsor-Essex. Testing at assessment centers is for those with at least 1 symptom of COVID, high-risk contacts as directed by public health, and workers or residents of a facility experiencing an outbreak as directed by public health. Windsor-Essex County has 3 assessment and testing centers: St. Clair College Sportsplex, Windsor Regional Hospital Olet Campus, Erie Shores Healthcare in Leamington, and SOHAC in Windsor offers testing where it's available for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must stay home and remain isolated pending your result. The health unit will call you if you have tested positive for COVID-19. Please note that starting next week, we will be shifting to a new schedule for our YouTube live updates. After Thanksgiving, we'll shift to updates Monday, Wednesdays, and Fridays. So next week, we'll have our first update on Wednesday. Please continue to visit our website at wechu.org for further information. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us today. Yesterday we provided notice to owners and operators of agricultural farms within Windsor-Essex of an update to our class order under the Health Protection and Promotion Act. The update released October 6th replaces our previous order that was dated June 12th. The order is to all owners and operators in Windsor and Essex County who employ migrant farm workers in any capacity, participate in Federal Temporary Foreign Workers Program, operate any model of seasonal housing accommodation. As we are seeing the cases increasing in Ontario, we must not forget that not long ago, our region had the highest case rates in the province, and we even reported 98 new cases in just one single day, our highest daily case count of COVID in the region. This is an important reminder for everyone in Windsor-Essex that how quickly all of that can change. In order to prevent a surge of cases in the region, we are working with all our partners to ensure that we are not being complacent and continuing to follow public health measures. We have updated our class section order and added additional points for clarification. Most of the farm owners operators are already following all these recommendations, but this order will formalize the expectations, and it includes Ensure that all employees, current or future, are exclusively working within one location. Ensure that any contracted employees, current or future, exclusively work at one workplace and must work separately from others on the farm. They are not to come in contact with anyone else. Ensure that accurate and updated contact information for all employees is available and provided within 24 hours to the Windsor-Essex County Health Unit. It is critical for our team to have that information for a good case and contact management. Follow all directions provided by the Windsor-Essex County Health Unit pertaining to COVID-19 and this order. Conduct daily, at minimum, active screening for symptoms and exposure history of COVID-19 and keep a record. Our team will request that record at occasion to make sure that all the measures are being followed. Ensure that employees working on the farm are cohorted, maintain 2-meter physical distancing from others, and use appropriate PPE as needed based on the risk assessment. If employees reside together, they should also work together. Ensure that employees understand their right and entitlements, including access to healthcare services and other supports. Provide educational materials and information on COVID-19 in the language of the employee. Ensure that all temporary foreign workers that arrive in Canada are isolated for 14 days from the date of arrival in Canada. COVID testing is not required during quarantine unless the workers develop any symptoms of COVID-19. Maintain a list of names of all temporary foreign workers scheduled to arrive in Canada, their date of arrival, and plan for isolation. Ensure that temporary foreign workers in isolation are kept at a minimum of 2 meters apart from other workers, or provide a separate room or alternate accommodation for isolation. Ensure that provision of water, food, laundry services, and cleaning for workers in isolation is available. Notify the Windsor-Essex County Health Unit of any worker that develops symptoms during quarantine, or any worker that's working in the farm. Ensure that workers subject to 14 days isolation period do not work on the farm or any other farm, and notify the Windsor-Essex County Health Unit if the worker leaves isolation location for any reason, such as seeking medical attention. Ensure that all living accommodations for temporary foreign workers are inspected by a public health inspector prior to occupancy, and that all other approvals are in place, including those from local municipality, fire, building, and bylaw agencies. Ensure that the health unit is contacted for approvals related to renovation of any accommodation for temporary foreign workers. Ensure that cleaning and disinfecting supplies to all temporary foreign workers are provided for their accommodation. Ensure that there is a separate room or alternate accommodation available for isolation if your workers need it. Ensure that all individuals under health unit supervision for case and contact management have ongoing access to communication devices, phone, and this contact is made available to the health unit at all times. Ensure that all known instances of non-compliance with the Quarantine Act, the Emergency Management and Civil Protection Act, and Reopening Act are reported immediately to the appropriate agency. These measures are necessary and required to mitigate the risk associated with the increased transmission of COVID-19 among agricultural settings, and ensure that we continue to prevent the spread of COVID-19 in our community. For full details of the order, please go to our website at www.wechu.org/CV/guidelines. Thank you.
The conference is now unmuted.
We'll now take questions from the media. We'll start with the Windsor Star.
Good morning, Doctor. We have seen reported of very few cases among agricultural farm workers over the last few weeks, but as we know, they haven't led to outbreaks. So have the measures in place been working?
Well, I think that's a good question, and we want to make sure that those measures are working. Seems like they are working. We haven't seen an increase in the number of cases, but it is important that we know how quickly it can spread. Some of the expectations that we want to make sure is there to make sure that the employers are continuing to have those measures in place. It is critically important. Our team will be in contact with them. We will be monitoring them. We will be inspecting them. We will be we'll make sure that they are following all those guidelines. And it is really important that we prevent any outbreak in these farms and in these facilities because it can easily spread not only in the farm, but also through the farm to our community. And right now, even though we are seeing a single-digit case number daily, but if we see that we're reporting closer to 10 cases every day, so I think it's a reminder that things can quickly get worse, and we want to make sure that the residents of Windsor and Essex, they are aware of their obligations, requirements. Employers are aware of their obligations and requirement, and especially the high-risk vulnerable population. They're also aware of what they need to do to prevent that spread in that population.
Thank you.
Any questions from Blackburn? Any questions from CBC?
Not today, thank you.
Any questions from AM 800?
Dr. Ahmed, was the order set to expire and that's why the health unit renewed it, or is this just an update?
This is just an update. We needed to add a few additional points for clarity, and as I said, most of the workers, most of the farm owner operators are already doing that. We wanted to make sure that it's written, documented. The expectation is very clear. So when we are there, when we are requesting some of those documentations or process in place, we want to make sure that it is there. And that's one way of reminder as well for the owner operators that what those expectations are, because clearly the initial order was issued on June 12th, and now we're talking about July, August, September, October, like almost 4 months down the road. So we want to make sure that it's almost like a renewed expectation, and making sure that it's all of that is followed.
Okay, thank you. Just looking at the website for the public exposures, the possible exposures, just wondering, I don't think you can share these details, but I'm going to ask. The Walmart in Amherstburg, there is about 6 cases, 6 straight days. Is that an employee that went to work for 6 straight days that had symptoms or showing symptoms?
Well, Rob, as much as we try not to get into that details, which can potentially identify an individual, but all I can say is all those 6 days, if someone visited that, they could be at risk, which is a low risk. Just please note that these are all low risk events. If it's a high risk event, we will report it as such, but this was a low risk event. So please, if you visited that during those days, you take precautions, you follow all those, you self-monitor yourself.
Okay, thank you.
Any further questions from the Windsor Star?
No, thank you.
Blackburn?
No, thank you.
CBC?
No, thanks.
AM 800?
Just for Teresa, not a question, just going back to what she said about the daily updates. What time will the release, I guess, be sent out for the daily updates on the Tuesdays and Thursdays when you're not meeting with us?
The same time, you mean the numbers and everything?
Yes.
Yeah, that'll be the same time, and I believe it's by
Typically 11.
11.
Okay, perfect. Thank you.
Okay.
Right. Okay,
Thank you.
Thank you.